So, maintaining boundaries in medicine, I think, is an incredibly important topic that often goes under discussed when we're training medical students and residents. And maintaining those boundaries in an age where people are accessible pretty much all the time, anywhere on the planet, is getting increasingly difficult. And I think that the two areas where that makes the most sense and that is the most important, certainly, is in the area of social media and cell phone communication. The reality is we all use social media and we all interact with people via Facebook or Twitter or even our cell phone. These are all things that fall under this realm of social media. And so I'll talk a little bit about kind of social media specific applications such as Facebook and Twitter, and we can talk about the cell phone. The reality is that the best way to protect yourself is to try to keep a very healthy distance between yourself and your patients on social media. The way that you can do this is by having perhaps a separate page that is purely professional, that you can become friends with your patients on through things like Facebook and Twitter, but only has professional information. And you can use that as a tool by which to disseminate information. But your personal Facebook page that you might have with your friends from college or from medical school is probably off limits and should be off limits for your patients, simply because it can unfortunately be used against you in various situations. For example, if you were to go out for a night on the town and post pictures on Facebook and a patient saw them the next day before you took them to the operating room, that might raise into question whether you were capable of doing that. Had you had enough sleep? Had you been drinking? These type of things are not things that we want to deal with on a day-to-day basis. So these personal kind of interactions are best kept to the most professional level with regards to patients. The second thing is your cell phone. And your cell phone is a way in which you can easily communicate with people, but can also be a way in which patients can contact you at inappropriate times. You have to be very careful and judicious in who you give your cell phone number to. And probably the best thing to do is to not give it out, or give it out with very specific restrictions. I've given my cell phone out to some of my patients, and for the most part, nearly 99.9% of the times, they have not abused it and called at appropriate times. The other thing that we should all remember is that there are medical legal reasons for not giving out and sharing too much information with cell phone and social media, and that is, in order to have a medical interaction, it has to be in a way that is protected and is secure. And oftentimes when we send text messages or talk on the phone, or we communicate via social media, these things may not be encrypted and may not protect patient safety. So the bottom line is we should keep a certain distance, a reasonable distance between our patients and our personal lives with regards to social media and the cell phone.